number of boys routinely circumcised in the United States has fallen from 90 to nearly 50%. Those numbers continue to plummet as parents use available resources to dispel myths and expose the risks and harm of circumcision. Remember, what you don't know can hurt you or your child. Today's parents are saying no to circumcision. For more information, visit www.nocirc.org.
Hi, I'm Dr. Dean Edell. I'm a physician and host of the nationally syndicated Dr. Dean Edell Health Program. If you're watching this DVD, you are most likely in the position of having to make a very important decision on your child's behalf, whether or not to have your doctor perform a surgical procedure, a circumcision, on your son. As a parent, and I'm sure you will agree, it is incredibly important that we educate ourselves fully in such situations so that we can make the best and most informed decisions on behalf of our children. This is our intrinsic responsibility as parents and guardians of all children coming into the world. So the first question, obviously, is what is a circumcision?
Truth is, most people don't even know what a circumcision is. Seriously. Ah, the heartwarming coo of a newborn baby. Actually, that crying is the result of the most common surgery performed in America, circumcision. It happens to over 60% of newborn male babies in the U.S. 1 million times a year, 3,000 times a day, once every 26 seconds, a newborn baby boy has the tip of his penis cut off. No wonder that little newborn baby so pissed.
The foreskin. What many people don't realize is that the foreskin is actually a normal functioning part of a male's anatomy.
The skin that covers the penis is unique. It is movable. It is not attached to underlying structures. So this skin goes out over the shaft of the penis in a tubular arrangement, up over the head of the penis, and at some point near the end of the penis doubles under itself. So this tubular mobile sheath of skin has the ability to unfold and enfold. So when the penis becomes erect, the inner foreskin unfolds and actually becomes the skin that covers the shaft of the penis. At the tip of the foreskin, as this foreskin takes a turn and becomes the inner foreskin, it transitions into mucous membrane. That doesn't mean it produces mucus. It's similar to the eyelids, for instance, where you would find an outer skin portion of the eyelid and an inner mucosal portion, or the lips as they transition from the skin on your face into the deep red mucosa of your mouth. The American Academy of Pediatrics also says that the foreskin is a protective part of the human anatomy. The foreskin, it turns out, is a highly nerve-laden, highly vascularized complex of sexual organs that are vital to natural sexual function.
So now we know what the foreskin is and how it works. This then begs the question, why would we remove a normal functioning part of the body? There have been many varied reasons cited for the continuation of a practice deemed by medical associations worldwide as unnecessary.
Here's what the American Academy of Pediatrics actually has to say. The benefits are not sufficient to recommend that all infant boys be circumcised. Adding, it's the most brutal thing I've ever seen in my life. Okay, they didn't say that last part.
One interesting fact about circumcision is that there is no single argument or medical reason that points to the necessity of the procedure. And actually, the argument for circumcision has been quite varied, often based on religion, myths, and even fear. Circumcision is the only surgery on record that has been performed at times as a religious ritual, at other times as a puberty rite, and at times for a variety of other alleged medical reasons.
During the 1800s, it was believed that masturbation caused disease, and so cutting off the most sensitive part of the genitals would prevent boys and girls from touching themselves and masturbating, and that would prevent them from having disease.
Well, it's probably this idea that the boy must match his father. And I've actually talked to people who have written child-rearing books who say that if the father is circumcised, the son must be circumcised or he'll suffer some psychological damage. Now, I've been doing this work for over 20 years, and I've never heard a stitch of evidence that this has ever happened, that a boy comes up to his dad and says, "When do I get to have part of my penis cut off?" The other myth is that the boy must match his peers. Those are actually two social myths that spring out of the medical myths. And the medical myths are these: that the foreskin is superfluous and redundant tissue, that babies are incapable of feeling pain. The pain involved in circumcision, to use the words of the American Medical Association, is severe and persistent. The other myth is that it is difficult to keep an intact penis clean, when in actuality the American Academy of Pediatrics says that no cleaning is necessary. You do not need to retract the foreskin. You simply wash the external parts.
Just wash it off with a little soap and water. We're in America, not some gutter on the poor side of Calcutta. We don't have to wash with sand, unless we want to. Today's soap is soft, it fights bacteria and smells like spring rain in Ireland, or so we're told.
So now, as the circumcision rate is dropping, which is wonderful, we're faced with another problem, and that is that the physicians who are taking care of intact boys themselves don't have a foreskin, so they don't know how to care for it, and they've been given a lot of erroneous information by well-meaning medical sources who don't have the facts.
It is important for parents to consider the actual surgical procedure. How does the doctor remove the foreskin? How much does it hurt the baby? Do they use pain medication? And what about the recovery process?
Pain is a critical issue. Pain is not insignificant, and that's a complication of every circumcision. Every physician that I've ever talked to, including pediatric urologists, don't know is that the underside of the penis and the lateral aspects of the penis are innervated by the perineal nerves. So if you're doing a dorsal nerve block, that may eliminate the pain on the upper side of the penis, but when you get cutting on the underside of the penis, the baby will start screaming.
Circumcision is excruciatingly painful. Even if an anesthetic is used, the most effective anesthetic takes injections into the tip of the penis, so that hurts. And then once the anesthesia wears off, the baby's going to experience the pain of a raw wound into which he urinates and defecates for a week to 10 days while that wound heals.
Infants are more sensitive to pain. We used to think that they didn't feel pain at all, and they were doing open heart surgery on babies without anesthesia. But we now know that infants are more sensitive than adults to pain. And to do something like this as your first experience out of the womb is barbaric.
The reason I started my work was because I heard the scream of a baby being circumcised. I had been told by the doctor that it didn't hurt, it only took a moment, and would protect my babies from all these terrible things that would befall them if they weren't circumcised. When I witnessed a circumcision, to see baby boy strapped to a plastic board, spread eagle, without an anesthetic, have a part of his penis cut off. And he screamed in a way that I'd never heard a baby scream before. I'd never heard that sound come out of any human being before. And that really is what instigated me and caused me to do the work that I've done.
Next, we go ahead with the procedure. After the drapes are placed, we grasp the foreskin with a couple of hemostats to stabilize them, like so.